What we're going to do to start off, if that's possible, is we're going to get everyone in the team to introduce themselves. I'm going to kick off with Lizzie. Do you want to start with this?
Yeah, of course. Morning, everyone. So my name's Lizzie Mullier. I'm one of the course officers that work in the team. So I do all the admin side. I'll be here for you while you're actually on the programme.
Good morning, everyone. I'm Victoria and I'm the Programme Manager on the Executive Masters in Medical Leadership Programme. I work closely with the course director and the academic teaching staff to make sure that the programme is run in a successful and high quality way. And I also provide the students with ongoing support and guidance throughout the duration of their studies.
Hi, good morning. I'm Ruth Walensky, and a lot of you will know me from being the first point of contact about the programme, introducing you to what's expected, how to apply, what the admissions criteria is, and so on. So welcome everybody.
Good morning everyone, my name is Matt Bungay. I'm the head of apprenticeships here at City, so I look after all of the apprenticeship courses and I will be advising you on the eligibility criteria, what to expect from the apprenticeship, and any other questions you might have at the end.
Nick.
Hi, I'm Nick Prince. I've just completed the course, so been studying hard over the last couple of years, and I'm also a paediatric intensive care consultant at St George's Hospital in London.
Hi everyone, I'm Bansri. I've also recently completed the course. I was in Nick's cohort. I am an ophthalmologist by training. And I was recently working at Moorfields as a consultant, but now I'm doing some more healthcare consulting type work.
Brilliant. Thank you very much, everyone. We're quite a tight-knit team on the programme. I think Bansri and Nick can agree that we've been together for a number of years. The course was set up about 7 years ago. We're now on cohort 6, and you will be part of the new cohort 7. The degree came out of, I suppose, my research in terms of my own motivation. So I look at leadership, what I now call expert leadership, and that is, it asks the question, do we need core business experts running organisations or general managers? And healthcare was one of the areas that I looked at. I did quite a lot of research in the area. I'm still doing lots of research in the area. And I've managed to find, though replicated beyond healthcare, in all settings, in all work settings, in fact, that we want core business experts to be leading our organisations. And what that means in terms of healthcare is particularly doctors. We need more doctors in leadership positions in healthcare. And one of the things that we present very early on in the course is the evidence for this, and it tends to have quite a big influence on our students when they can see the evidence behind why doctors need to be in leadership and management positions. And unfortunately today we've had the sad news about the Shrewsbury and Telford Trust and the bad things that have been going on there. Just to put that in context, I'm not going to go into the details of that, I don't know enough about it, but in terms of what's happening in the NHS at the moment and in healthcare settings in general, private, public, doesn't make any difference to us. We cover all. We cover the many private organisations, and also we have many NHS trusts involved. I believe that if you have medical leaders at the top of organisations, then that's going to be a pull to other doctors to come. It sets a medical standard in institutions, and I think that that's something that the NHS has been very slow at doing, actually. Just very quickly, if we look at the two most outstanding healthcare organisations in the world that just were recently ranked 1 and 2, Cleveland Clinic and the Mayo Clinic, they have only ever been led by doctors, only ever, and they have never ever had a general manager. Now, I'm not against general managers, don't get me wrong, everyone has a role to play in an organisation, but we're talking about leadership and line managers, and that's why we set this course up. We felt there weren't enough courses that were exclusively for doctors. So nurses have been training in isolation around leadership and management for about 30 years. There's been lots of courses for nurses, and some of them are only attended by nurses. The same wasn't true for doctors. There were very few courses that were only for doctors. So we created this degree, this 2-year part-time degree. I'd just like to say hello to Ruth McCabe, another one of our doctors who's joining us as well, in case Bansri has to go off. We created this degree, which was supposed to be a safe space for doctors to learn about leadership and management, and to be able to speak out, to be able to say how they feel, to be able to talk about failures, successes, etc., within the constraints of a doctor-only course. So to create a safe space. Now, you might think that that's not a diverse group. It couldn't be more diverse in all ways. We're a very, very diverse group of students, and that's also, of course, includes all medical specialties. So let me just move on very briefly to the course, and I don't want to take up too much time, but we start off with you. The lens is on you individually to start. We hold a mirror up. We ask you to think about your behavior, to reflect on your behavior, because management and leadership is very much about behavior. It's very driven by behaviors. So we help people to think about how they communicate, how they present to others. We do training in having difficult conversations. So if you're a line manager or a leader and you want to have a difficult conversation, we know that doctors and nurses and other clinicians are really good at talking to patients and sometimes telling them terrible things. But when it comes to actually having conversations with their colleagues in a management situation, that's a very difficult thing to do. So we train you in that. We also put you into action learning groups, which you run through the entire course. These groups become incredibly intense but motivating things, and a lot of our students lean on these groups all the way through the course, and a lot of work stuff is discussed with them, etc. You have an executive coach that runs with you throughout the whole degree also, and this all comes out of the first one, the first module that you have. You learn 2 days, Friday and Saturday, every month between early September and May, so that the teaching doesn't run throughout the whole year. The modules that we have following the personal leadership development one, which I teach with someone called Natasha Moore, who is she's a leadership development expert and an executive coach. She's been involved with the program, including actually designing parts of the program from the outset of this course. We then widen the lens in the next module and look at managing people and change. So that's about going now from the individual into the manager, into you as manager, and looking at teams particularly. We then look at expert leadership, which is again with me, where we look at why we need doctors in leadership positions, other clinicians also, but why we need good doctors to go into leadership positions. We then go into regulation and policy and strategy. We have leading innovation in healthcare. We have a fantastic module, managing accounting in business. Now, most people, especially doctors, will go, yeeks. But actually, I think everyone who's here on the course will contest to the fact that it's taught brilliantly, actually. And it's actually one of the most popular modules, in fact, because she does such a great job on it. We have healthcare analytics, and we have marketing and machine learning. And then finally, we have this thing called a leadership impact project. And that is where you embark on a major initiative with your healthcare provider, with the organisation that you're working. It may be something that you're particularly interested in. It will come from a collection of your learning throughout the whole course. And in discussions with your employer, you will pick some kind of major change initiative. And I think the doctors who are on here today, the ones who run the course, can talk about the ones that they did. But that's quite a major project that takes up 2 modules. And that's very much driven by you, and you work with the supervisor as well. And it starts in year 1, but the bulk of that work is done in year 2. I'm just thinking about my time. I think I'm going to stop there, and we'll have more things come up in your Q&A. We really want to leave time for Q&A. I'm now going to hand over to Bansri, actually, who is one of the few doctors who are on the webinar today. Bansri.
Thank you, Amanda. So I was reflecting on the course, and I just really want to highlight 3 things that I took away from the course, and also just talk a little bit about how it's really changed the direction of my career and influenced my future choices. So the first thing I wanted to talk about is like the structured approach that the course gives. And one thing that I really benefited from was like the tailored learning. So all the modules that Amanda mentioned are really tailored for doctors to learn. So when we learn finance, when we learn accounting, they acknowledge that we have no prior knowledge whatsoever, and then tailor their teaching to maximize what we get out of it. And alongside this learning, there's also, because we're doing it part-time, there's also opportunity to implement it immediately in your workspace. And for me, this was amazing. It really changed what I did in my last 2 years of training as an ophthalmologist. And it fed directly into my impact project, which was ophthalmology transformation, particularly in developing virtual glaucoma clinics. The second thing I wanted to talk about was the incredible support network that you get access to, both in terms of peers who are amazing. And, you know, like I spoke to Nick last night, we had a great catch up. And I think it's unique to be connected to doctors across the country, working in top hospitals who are aspirational in how they want to change the healthcare system. And just to have access to them and to be able to call them, you know, beyond your master's work, it is unique. And I can't think of anything else that I've ever been part of that's given me this network. It's understated, but very, very important, and really grateful to the course and to everybody else on it for giving me that network. And the last thing I just wanted to mention was the ongoing mentorship that you get throughout the course and beyond. What I would say is that everybody, you know, from the faculty to your module leaders, are very invested in your growth. So they tailor what they teach you, they make themselves available, so you can really maximize what you get out of the course and the impact that you make, both whilst you're on the master's program and beyond. And just to reiterate, this support and mentorship does not stop when you finish, when you graduate. In addition to that, just to reiterate what Amanda mentioned about having a coach, for me, it was the first time that I took coaching seriously, and it changed my life completely in terms of recognizing where my weaknesses were, recognizing where my strengths were. It gave me a space to reflect on how I could grow without providing me answers, but just giving me time to work out the direction in which I wanted to grow. And that's a space that often we don't get when we're busy in the NHS. Our well-being and our growth is something that we deprioritize. And so many elements of this master's course has helped me prioritize, like, how can I be the best version of myself so I can contribute and make the greatest impact in healthcare, particularly in the NHS. So yeah, that's a little bit, that's a whistle-stop tour through my master's experience, and I really could not recommend it like highly enough. I think it's been a key changing point in my life for so many reasons, and more than happy to answer any questions that you have on it.
Thanks, Bansri. I'm going to hand over to Nick now, and then maybe there'll be a couple minutes for Ruth to say something very quickly as well, if she doesn't mind. Nick.
Brill, thank you. Lovely to see you all. I'm just going to pick out a few key themes that were important for me. So one is about the business school, two, the taught content in the course, and then I want to focus a little bit on our peer group and also the apprenticeship funding route as well. So everyone here today, I'm sure, comes from a really diverse background, but nonetheless, you know, we're all doctors and we've had our experience of medical education and training. Just doing this course through a business school for me was a really different, engaging thing. You know, being in a professional environment, being in the city, the kind of support services that come with that in terms of the IT, the tech, the access to all the journals and that type of thing to help us with our studying. So actually for me, the business school, I would say, was a real plus and opened my eyes to a focus on healthcare from outside of our local organisations. So very different really to my training and learning experience within the NHS. In terms of the talk content, I think probably the highlights will vary for everyone a little bit depending on your interests and experience. but the course absolutely gives a really broad coverage. And for me, actually, the face-to-face days where I got to come along and learn and join with our peer group, they really became a highlight of my month following the programme. In terms of the faculty, really just to reiterate what Bansri said, I mean, it's such a friendly faculty, and I think actually we felt by the end that the faculty were part of our peer group. And having finished the course, I really feel that I could make contact with any of the people that have taught us if I had a particular project to take forward. And the main thing is that I found most inspiring, I think, was actually the faculty are undertaking research in healthcare leadership. And in the NHS and healthcare, we're always driven these days to think about evidence-based healthcare. And actually, that's what we were learning. We were learning evidence-based healthcare leadership. So really important for us. My leadership project was essentially looking at how I could get our trust to expand our paediatric intensive care. So not the actual building of it, but issue selling, seeking buy-in, and ultimately gaining funding for the expansion. Then the other aspect within the course is a management placement. And I think for us, probably that was curtailed quite a lot by COVID. But I think, you know, my dream management placement would have been to go abroad, possibly to North America, and perhaps do some sort of clinical and management observership in a centre that inspires me. But COVID took over, so we didn't do that. So what were my highlights of the talk content? Definitely the early modules, so reflection, personal development, things like looking at emotional intelligence and really thinking about myself and how I could develop. Comparisons with industry and the evidence I found really important for me, healthcare analytics and definitely finance and accounting. But as I say, I think that will be unique to different people. So that's for talked content, and I promise I'm nearly finished, Amanda. Last two bits were our peer group and the apprenticeship funding. So in terms of our peer group, you know, people were from NHS, private sector, hugely varied stages in career. We had some very junior people that they're relatively small in number, but they really gained a lot from the course. Then we had senior clinicians, and we had people looking for different perspectives on their career. We had people who just entered senior management roles, and we also had people who are a little bit more established. But I think the key thing is actually from all of our face-to-face teaching is as a group, we really came together. And what Amanda talked about in terms of the safe space and lots of open and honest discussions, I think we all took a huge amount of peer support from all of the other people on the course with us. And certainly the action learning sets were important for that. And then finally, the apprenticeship funding. I came through the apprenticeship route. So effectively, my trust paid the bulk of me doing the course. And that had two major impacts for me. One, obviously, it was paid for by my trust, which was a huge bonus. And I've done other MSCs in the past, which I've paid for. So it was light relief that someone else was paying. But actually, over and above that, it really gave me a feeling that my trust were investing in me as a person and in my development. So if you can go through the apprenticeship route, I would do it if you can. It brings a few additional hurdles at the end, but I have to say they're not onerous in any way. So a thumbs up to apprenticeship funding for me. And then finally, what's the outcome been for me? I've been approached for some additional leadership roles since completing the course. And actually at this stage in my career, the course has given me the confidence to say no to those offers to apply for things. But nonetheless, I felt recognised by my trust, and actually having completed the MSc, I think it's put me on people's radars to look for future leadership roles. Sorry, that was a bit long, Amanda, but they're my thoughts. Great. Anyway.
No, I'm sure everyone really wants to hear from you guys. Ruth, do you want to just add? You've got a couple minutes, which I can give you, my dear, although questions might come your way. Is there anything you want to add? Hasn't been said. You were one of the earliest. You were a guinea pig almost, weren't you?
I was a guinea pig, and look, I survived. And even managed to, survive in a good enough state, which you can't always say coming through parts of medicine, that other people saw our guinea pig cohort and realized that we were actually still alive and had enjoyed it. I think one thing, I'm not going to repeat the great things that Nick and Bansri have said, because we all had a fantastic time. I found that actually we became a very close-knit little unit, and those bonds have actually endured well beyond a couple of years down the line from the course now, but they also do stretch across the cohorts of people we've met in other cohorts, even just virtually. You do have that bond because you understand actually that you're meeting with, as people said, like-minded people who really want to use all that clinical experience and know-how to move the system to. And the nice thing is that all the people like Amanda and Amit, Natasha, all from the business school side of things, they also want to let you do that. And they want to say, hey, we've got all this other experience. If we can introduce you to this and that, look at what you can do when you put that in. As a guinea pig, what our cohort found was that the business school was incredibly responsive to all our feedback. And you give feedback in, again, other aspects of medicine, clinical courses, exam courses, and actually nothing much happens usually. There might be a bit of nodding and saying, yes, we'll take that on board, thank you so much. But the business school changed things because they actually do want to make this as good as they can. And it was great because when you're starting from something that really works and everyone's really enjoying, and then you're keen to improve it, that's just fantastic. I've stayed in touch with several of the people who taught me on the course, and to add to what Bansri and Nick have said in terms of confidence, for example, as Nick said, the confidence to say no to things, certainly that helped me. I mean, and with the coaching as well, I think it then did give me the confidence to take on roles. And if you'd said to me, Ruth, go and do this, I'd have gone, not in a million years could I do that. But it was actually to be a step back and think, well, actually, these are some really quite senior and experienced people, and they think I can do it. And actually, when I look at it, I have got the tools to do that, and then I actually did manage to go and do it, and it worked. And it's been fun. And the nice thing is for me, it's been an experience to give that basis on which to keep learning and give me more tools to do the things that I want to do. And also, I think not to get knocked back and worried, and the terrible crushing feelings of rejection if you don't get a job you've applied for, and because we can become very inured to that through our medical careers, and everything hangs in this one job interview. It doesn't. And with so much to build on from the course, it's been fantastic. And for me, the start, I haven't had a typical career coming into this. I'm certainly not having a typical career now. I'm out the other side of it. But it's great, especially as they keep pushing the retirement age up. So why not?
Thank you very much. That's brilliant. And of course, everyone, Nick, Ruth and Bansri are here to answer your questions as well, if you have any. So just very quickly, a couple of things that got picked up that are really important. The placement part of the degree actually doesn't, we had to take that out because of what was happening with the apprenticeship levy. It didn't fit into the apprenticeship levy stuff. So we've actually got marketing and machine learning in there now, which was in response to students actually who asked for that to go in. A major part of this course and the design of this course is that you don't just go away and do some learning and then get chucked into work having done your learning with all your new tools. And then it's kind of like, OK, what do I do now? Who's going to let me use all these tools? What you tend to do is you do your learning and then you step into work on a Monday or a Tuesday morning, whenever it is you're going in. So the point is that you learn, you practice, and that's a very important part of this course. Just very quickly as well, as has been picked up, it's evidence-based. As much as I can as course director, I try and avoid jargon, management jargon, grates me, and I know that great experts and professionals, it usually gets on their nerves too, so we try and keep that to a minimum. Now on the fees, just very quickly before I hand over to Matt Bungay, who's going to talk about the apprenticeship levy. The fees have now the government reduced the fees on the apprenticeship levy from 18 to 14, and we obviously have done that also. We did have a top-up element to it running for a couple of years, but in fact, we've now brought it to 14, both for those people who want to pay for themselves and those people coming through apprenticeship levy. There is now no top-up element to it. So the programme essentially is £14,000 now, and that obviously covers the 2 years and everything that we've discussed as well. I'm now going to introduce you to Matt Bungay, who's going to talk to you about the apprenticeship levy route, which is the route that most students come through. So Matt, thank you.
Yeah, thank you very much, Amanda. Excuse my throat. I have a bit of a sore throat, so it might cut in and out, but hopefully it'll be okay. So I'm just going to explain really about the apprenticeships and how it works. So as Amanda's just said, the apprenticeship route does allow you to be fully funded by your employer. So that is the key factor now. There is no additional top up required. So the 14,000 will come directly from your employer and will pay for your course, including the masters. The reason I say including the masters is because by running through the apprenticeship route, you actually gain 2 additional qualifications. So you will come away with the masters in medical leadership. You will also have a senior leader apprenticeship standard at level 7, and that is accredited by the Chartered Management Institute at level 7 as well. So you come away with 3 very well recognized qualifications. Now, the apprenticeship runs in parallel to the masters, so you don't need to do a lot of additional work, although as Nick alluded to, there is some additional work required towards the end. But I'm just going to explain what that means. So the knowledge, skills and behaviours that are required in the apprenticeship have been built into all of the modules that are taught by the various module leads. Now, the knowledge, skills and behaviours is how you demonstrate the skills that you have learnt and the knowledge you've gained in the business. So as Amanda said, this is you've been taught something, go and apply it in the work. How do you go about evidencing that? So this is evidence-based, and we use a system called Aptum, which is an online learner management system where you're able to upload all of your evidence that you've completed, how you've applied your knowledge, and how you're using your new skills, all of which you will be trained on independently by my team on how to use that. But what this does is it does allow your employer to see how you're getting on. It allows you to see at the touch of a button everything that's coming up for you, including your touch points with your coaches, with your academic mentors, and how the course will run throughout the 2 years. The new knowledge that you learn has to be demonstrated in the business, and this is key because we are an Ofsted regulated university for the apprenticeship programs, which means we have to be able to demonstrate the impact of the knowledge and skills you've learnt in your business. As part of that, you are required to have 20% off the job funding. So that means if you work a 37.5-hour week, you have to have 7.5 hours a week of off the job to be able to complete your apprenticeship and your masters. Included in that is the time that you'll spend the 2 days a month in your training, so at the university. But also we need to be factoring in how to use that to complete assignments and any other work that is required of you. So how does the levy work? So the levy is set up by using a digital account service known as DAS, which is basically an online digital account that your employer has either already got or can access, and we are able to help them set that up. By doing that, they link with us as a university, and then all of the money is moved in the background by the magical digital people that do it. So it's very straightforward. Your employer doesn't need to worry about it too much, and you certainly don't. So we can help with all of that. That means that we're paid on a monthly basis to deliver the training to you. So you don't have to pay anything yourselves. There is eligibility criteria alongside this though. So because these are apprenticeships that are funded in England and precisely in England, that does mean you have to spend at least 50% of your time working in England. You also have to have lived and worked in the UK for at least the last 3 years, and you have to be able to prove that upon application. There is also the requirement that you hold a GCSE in English and Maths or an A-level equivalent, which is all I can see Amanda shaking her head there, which is unfortunately part of the government guidelines for anyone who comes onto an apprenticeship. So you have to be able to evidence that with a certificate, or we can help you try and find evidence of that by previous certificates you had. However, If you don't hold those certificates, you can complete the functional skills as part of the apprenticeship. So it's not a deal breaker. It doesn't mean you can't do it. And we are not teaching you GCSE maths and English. We are teaching you functional skills that runs alongside the program. So it's not as daunting as it may sound. So how do we apply? What is the application process? So we are going to be opening applications towards the end of April. I can't remember the exact date, but I'm sure Victoria will remember that. And it will all be done through Aptum. So you'll get to meet Aptum very early in your journey. And it's all done through an onboarding wizard where you can upload your documentation, complete all of the details that we need, and we will gain that by having your first name, second name, and email address. Then you will then be invited to join Aptum. As part of that process, you will complete something called a skills radar, which assesses all of your skills as you currently are. Now, bearing in mind, this is all of the knowledge, skills, and behaviours that you are going to be taught on this course. We do not expect you to have all of them, and we do not expect you to have more than 50% of them. So you will rate yourself between 1 and 4 for every single one. As part of that, you'll then have an initial chat with an academic mentor who will discuss the apprenticeship and the course with you and how it will potentially work. And I think that is everything I needed to cover, Amanda. So I will hand back to you.
Brilliant. Thank you very much. Obviously, everyone is here for questions. Just a couple of things just to mention as well on that. In terms of the levy route, and the levy route is great because, as has been said many times, you get, you don't pay anything. It comes through your institution. They fund it. But the other side of it is if you did the non-levy route, it doesn't require quite the same thing. Now, we go through an interview process with everyone. And so obviously, we have a criteria for selection stuff. But I will say one other thing about well, two things. One thing about promotion. Everyone has mentioned this, certainly Nick's focused on it, but nearly all of our doctors get promoted very early on the course, actually, and that's something worth mentioning. It's something that happens, and we have people who we have the in Nick's cohort and Bansry's cohort was Adrian Cree, who went from being the group medical director of the Priory to being the group. Well, he went from being the medical director of a part of the Priory to being the overall group medical director of the Priory. And that happened while he was on the course. And actually that happened, I think you guys will know, a lot of the support he got from that was through his Action Learning Group, actually. So in general, people get promoted really quite quickly on this course. I thought that was worth mentioning. Secondly, in terms of seniority, we do have, you can see in the criteria for joining the course that we have certain years work that you've got to have done, but we like a mixture of obviously we like a diverse group, and that includes seniority. We found that people who are very senior, I think one of our current medical directors said that he learned a lot, Sanjeev learned a lot from having a few more junior people on the cohort, because the juniors in his organisation weren't necessarily the people who were talking to him and telling him what they felt. Whereas actually on the course, there was this fantastic exchange of information and ideas. And so people understood the position that they were in from different perspectives.